Welcome. Thank you for joining us. We're going to get started in just a couple minutes as more folks join the event. Welcome. We're going to give it another minute or so while other people are logging in, and we'll get started. Hi there. For those that joined us, welcome. We're going to get started in just a minute here. We've got some more people that are calling in. All right. Well, welcome, and thank you for participating in the official launch of the California Healthy Places Index. Today is an important day for the Public Health Alliance, and I want to thank you for taking time to join us. We're very excited to be sharing this dynamic and truly one-of-a-kind resource with you today. This event is being recorded. I already see some questions there, and we will be posting the video recording to our website later today. In addition, everyone who registered to attend this launch event will receive an email from us with a video link so you can easily share it with your colleagues, community partners, or professional networks. You can also check out our website, healthyplacesindex.org, with all these resources. I'm Tracy Delaney, the Executive Director of the Public Health Alliance of Southern California and the Healthy Places Index. I'm pleased to be joined today by some of my wonderful colleagues who you'll hear from in just a bit. Dr. Neal Maislish, our Senior Data Advisor, Helen Dowling, our Project Coordinator, and Bill Sadler, our Director of Operations. Before we get started, I'd like to point out our chat function. In case you need help or run into any technical difficulties with the webinar, just click the chat button on your Zoom display shown here. In the box that pops up, in the To field, select all panelists and attendees, then type your question. We have folks working behind the scenes today to help things go smoothly. The Public Health Alliance is a coalition of 8 local health departments across Southern California. Collectively, our members have statutory responsibility for the health and well-being of nearly 50% of California's population. The Alliance is working to bring about our vision that all Southern California communities are healthy, vibrant, and sustainable places to live, work, and play. The Alliance has 3 main initiatives reflected here in the 3 center boxes. We work on healthy neighborhoods and healthy food and water systems, and today's launch of the Healthy Places Index is the crown jewel of our data and action efforts. Each of the initiatives are grounded on 2 critical foundations: equity and opportunity for all, and a healthy planet to support healthy people. The Alliance is committed to advancing these priority areas using a policy, systems, and environmental change approach. And we know that effective public health and prevention infrastructure is essential to improving the health and well-being of all. Now that you know a little about us, here's the agenda we've planned for today. During this hour, Neal and I will provide a brief introduction to the California Healthy Places Index, including its foundation, process of creation, and results. We'll also share information about communication tools. And then we'll dive into the interactive Healthy Places Index mapping application with a video tutorial. Bill will follow the demo with some exciting examples of how HPI is already being used in California. He will also point you in the direction of additional resources that we've made available. Then we'll wrap up the one-way dialogue and move into the live Q&A portion closer to the top of the hour. So let's get started. The Healthy Places Index is a powerful new resource to support health equity and improved opportunities for all to thrive. This resource allows everyone to diagnose and change community conditions that affect health and well-being. It was designed intentionally to support informed prioritization of public and private investments, resource allocations, program planning, and service delivery statewide. We believe that every Californian should have the opportunity to live a healthy life. By offering extraordinary granularity across many social, economic, and environmental indicators, the HPI can be used to compare and assess local factors impacting health from neighborhood to neighborhood. As you can imagine, conditions for health are not uniform across the state or even within jurisdictions. The HPI was designed to help elevate both the health promotive assets and factors limiting optimal health at the community level. Our hope is that HPI ultimately is used to support thoughtful and strategic investments to improve health, particularly in communities currently experiencing less healthy conditions. Beyond investments, we believe that systems level change is also needed to address equity issues across our state. To support more equitable opportunities for health in California, policy solutions have been included as a key component of the HPI, and you'll hear more about this later today. Many of you are familiar with the social determinants of health, as defined by the U.S. Centers for Disease Control and Prevention. These determinants include the community conditions we know affect health and health outcomes: neighborhood and built environment, health and healthcare, social and community context, education, and economic stability. Our own Healthy Places Index is built upon this foundation. I'll turn it over to Neal now to provide more context on the background, development, and methodology behind HPI. Neal?
Thanks, Tracy. We started our project 4 years ago, and like most applied public health research projects, we conducted an exhaustive literature review of the practices of constructing indices of disadvantage or opportunity. This helped us understand how others had approached the topic and gather information on how individual indicators were selected, defined, and grouped into common topic areas or domains, as well as if domain weighting was used. This process also identified potential data sources. We heard loud and clear from our local health departments that what would be most useful are data available at high geographic resolution, such as the census tract level. Many national indicator projects stop at the county level, masking neighborhood or community conditions that local health departments prioritize. Now, we were accompanied in this process by a steering committee made up of members of the Alliance and Bar High data committees. Bar High is the Bay Area Regional Health Inequities Initiative. The data committees are mostly comprised of local health department epidemiologists, but also we had representatives from the California Department of Public Health's Office of Health Equity, other stakeholders, and our consultants at the Virginia Commonwealth University's Center for Society and Health, or VCU. VCU has been long active in developing indicator projects on the social determinants of health. Informed by this literature and guided by our steering committee, we selected the domains, which we call policy action areas, and individual indicators to produce an index which ranks each census tract in California by its healthy conditions. We visualized the resulting scores in a mapping application and created a website. Immediately, we started hearing from users with suggestions for improving the index. We channeled many of these suggestions back into the website and tool improvements. So this is really an ongoing and iterative process. What started out as the Health Disadvantage Index 4 years ago has evolved into the Healthy Places Index, with updated data, methods, and positive framing. We use the following criteria to select the individual indicators that make up the HPI. Informed by literature, statewide data publicly available at the census tract, continuity with the HDI 1.1. Over the years, we've had thousands of visits to our website and wanted to update the index, but not introduce a radical change for our existing users. Also, actionable for policy, systems, and environmental change. Indicators that lend themselves to action need to be specific and understandable to policymakers. In contrast, we reviewed other indicator projects that created very elegant indicators with highly desirable statistical properties that only a handful of data analysts really understood. We chose not to go that route. Also, optimize the association with life expectancy. This last point marks a pivotal change with the prior version of the HPI. Our steering committee urged us to validate the index against a health outcome. We chose life expectancy at birth, which most public health researchers and practitioners regard as a fundamental measure of community health that integrates over the entire life cycle. This focus on HPI being predictive of life expectancy recognizes the primacy of the social determinants of health in driving health inequities. Glaring differences in life expectancy exist within our communities. Often a 10 or more year difference in life expectancy can be found within a 20-minute walk. What makes the HPI so distinctive is its methodology, which employs weighting of the policy action areas to optimize the correlation between the overall HPI and census tract life expectancy at birth. This slide is a graphic illustration of the challenge and promise of HPI. This is a map of central Los Angeles County made up of blue and green squares which represent its census tracts. The darker the blue, the lower the life expectancy, and the darker the green, the higher. And we can see portions of the map in which stark differences in life expectancy occur in adjacent neighborhoods. Our goal is to turn this map into a sea of green where everyone, no matter where they are living, has the opportunity to live healthy and long lives. Most of the indicators were expressed as the percent of the census tract population that experienced an aspect of the social determinants of health, such as employment or poverty or educational attainment. Each indicator was put on a standardized scale using its Z-score, and up to 5 indicators were grouped within each of the 8 policy action areas, and we computed the mean score for each policy action area. We then computed the weights for each domain. To select the values of the weights, we used a statistical technique that varied the weights for each policy action area until the correlation of the HPI score and life expectancy was at its maximum. And the final score was the sum of the 8 weighted policy action areas. You can see by the circles below the policy action areas the relative size of the weights. Not surprisingly, economics and education accounted for nearly half of the total weight. So here's the listing of the 25 individual indicators in their 8 policy action areas. You can see the weights in percent under their labels. Many of the indicators are familiar. For example, employment rate, poverty, median household income under the economics policy action area. And let me just touch on some of the other indicators. For education, we used both enrollment in K through 12 and educational attainment in adults. For transportation, we used automobile access and active commuting, meaning walking, cycling, and taking transit. For social, we used civic engagement for voting and household structure. Neighborhood used a number of built environment measures, retail density, park access, tree canopy, supermarket access, and proximity to alcohol outlets. For housing, we used a number of traditional measures that include the housing cost burden for renters and homeowners, as well as housing habitability, crowding, and home ownership. For the clean environment, we use several indicators of air pollution and drinking water contamination. And for healthcare access, we used insurance coverage. Well, I know that was a whirlwind tour of our methods, so let me hand you back to Tracy to share a little about the communications tools.
Great, thank you, Neal. So in addition to the data steering committee that Neal mentioned, the Alliance also had the great fortune of a tremendous communications advisory group to inform HPI development. This group regularly provided feedback and specific guidance on how to most effectively communicate and deploy a positive frame across the tool, both visually and verbally. You'll hear more about this in a moment. We also had the opportunity to collaborate with VCU to produce a set of audience briefs that would introduce key sectors to the Healthy Places Index. On screen here is the audience brief for local government. There are additional briefs for community organizations and advocates, healthcare professionals, businesses, investors, and financial institutions, and state government. These audience-specific briefs are available on the HPI website, which is healthyplacesindex.org, under the Use HPI in Your Work tab. Another special feature that we believe sets HPI apart are its detailed policy guides. All 25 of the HPI indicators that Neal talked about are supported with policy guides. We hope this will help you in your work in taking data into action to advance healthier communities. In addition, we've provided policy guides for some of the climate change decision layers built into the tool. We know that many decisions that shape health are made at the local level, yet each jurisdiction is unique and requires policy approaches that are most relevant to local issues, priorities, and conditions on the ground. Therefore, the policy guides that we've developed include menus of policy opportunities, each with the potential to directly address the conditions tied to the indicators or to influence the root drivers of the indicators. Each guide offers content about how the policy is connected to health and includes a detailed description of relevant best practice interventions and emerging innovations of that policy area. We've also made an effort in the guides to share examples and templates or ordinances from jurisdictions that have already enacted these policies. Shining a light on this was important for us in the spirit of recognizing local public policy wins and hopefully helping build the case that these types of policy actions are doable. As always, when you're working on policy, particularly when gearing information and arguments to key decision makers, be sure to consider how to include voices of residents, such as storytelling and testimonials, and partners for all sectors like transportation, land use, advocacy, philanthropy, healthcare, and business, all who might want to join in advancing policies for healthier community conditions. During the demo, you'll see where to access these guides through both the HPI Map and the website. Okay, we're going to turn our attention toward the real fun stuff, the HPI Map and how to use it. This project could not have been accomplished without the efforts of many people, but Helen Dowling really deserves a shout out for all her talent, time, and energy that was poured into making HPI what it is today. Great work, Helen. I'll turn it over to you to walk everyone through it.
Thanks, Tracy. Before diving into the map, I'd like to provide some history and context for this tool. You might have heard of an earlier version we produced called the Health Disadvantage Index. With this new and improved version, we paid very close attention to reframing the data, the visualization, and the narrative information that accompanies the map, utilizing an intentional and positive asset-based frame. That starts with a new and more approachable name, the Healthy Places Index, which reflects our goal for this tool to be representative of community conditions, not individual behaviors, in neighborhoods across California. The color scheme used across the map is also something we wanted to be thoughtful about when designing the Healthy Places Index. We opted to use shades of blues and greens to denote the range of healthy community conditions, from dark green, representing the areas with the most healthy community conditions, along the spectrum from light green to light blue, and finally dark blue, indicating areas with less healthy conditions. At the Alliance, we believe it's important to avoid the use of reds or oranges on the map, particularly in light of historic redlining, which negated economic opportunities for people of color, but also because there may be an implicit association between shades of red or orange with warnings, stoplights, hotspots, or other negative connotations. Not surprisingly, communities that have faced significant divestment over time have fewer healthy community conditions today. Yet we know that every community has many factors at play, and regardless of the shade of blue or green on the map, every community has assets. We think the Healthy Places Index is uniquely designed to celebrate and recognize the health opportunities present in neighborhoods across California. With that in mind, let's start our tour. During this video demo, you'll see the many functions of the platform in use. We're excited to showcase the many ways you can explore and compare varying community conditions that predict life expectancy and health across our state. We'll also make this video available after today's event on our website, along with bite-sized tutorial videos for every map function. For now, please just sit back and enjoy.
Welcome to the California Healthy Places Index, a tool designed and produced by the Public Health Alliance of Southern California. This interactive, online mapping application is feature-packed, and this video will provide a full overview of everything it has to offer. When the map first loads, you'll see the entire state of California, covered in colorful squares. These squares represent groups of census tracts. To make sense of what you're seeing, take a look at the box in the upper right-hand corner. Here. The first item tells you what you're viewing. In this case, the California Healthy Places Index. Just below the title is a button that indicates what geography you're viewing. Right now, we're looking at census tracts. Below that is the legend, indicating what score percentile each color on the map corresponds with. As noted before, areas of dark and light blue indicate fewer healthy community conditions, where areas of light and dark green represent places with more healthy community conditions. This box and the legend will change as we interact with the map. If you're ever not quite sure about what's shown on the screen, simply return here to be reminded. Now, let's take a look at a specific census tract and learn more about its community conditions. We'll jump to Santa Ana in Orange County. When you select a tract, this details panel on the left will open. The first item is the HPI score, followed by a visualization of where this score falls within the 4 quartiles, from least healthy conditions to most healthy conditions. There is also an interpretation sentence to help you make sense of the score. We've also included some general information about the tract, including what zip code it falls in, as well as the population that lives here. Below that are 8 policy action areas, with many versions of the score visualizations indicating the percentile rank. We can also drill down in each policy action area. Let's take a look at education, for example. When you click this arrow, more information is revealed, including an interpretation sentence, plus a list of every indicator contained within this policy action area and their percentile rank. Immediately, you can begin to see the nuance that the Healthy Places Index affords. While the overall score in this tract may indicate fewer healthy conditions, it's not uniform. There are indicators, such as high school and preschool enrollment, that this community is doing really well on. You are quickly able to identify the positive assets in a neighborhood as well as those conditions in need of improvement, the health opportunities of this community. If you see an indicator of interest, such as bachelor's education or higher, you can click this arrow to get more information. As with the overall HPI score, you'll get a visualization and interpretation of this indicator's percentile rank in this census tract, as well as a host of specific details about this indicator, including a straightforward definition, the indicator's value, and here how this indicator connects to health. This connection to health text provides important context in simple language about the linkage between this indicator and health outcomes. Our goal with the Healthy Places Index is to make it easy to take data and turn it into action, giving you the tools to improve your community's health. That's where this section, Policy Actions to Address This Indicator, comes in. For each of the Healthy Places Index indicators, we've provided detailed policy guides that offer specific, actionable, and relevant policy solutions. When you click on any of these links, you are redirected to our website, dropped into the section of the full policy guide that corresponds with this heading. For each policy, we provide a short description, examples of the policy in action, and links to reputable resources for detailed guidance on implementation, toolkits, templates, and in some cases, funding opportunities. While we're here, let's hover over one of these little icons. These are our benefit buttons, flagging that this policy has extra benefits, in this case economic, but there are also a host of other icons, including those for policies that benefit equity, the environment, quality of life, and many more. We're excited to offer this detailed complementary suite of policy solutions alongside the wealth of data in the HPI. Returning to the map, you'll see that below the policy actions, we provide detailed information about this indicator, including the technical definition, as well as the data source and year. You can return to the policy action area and overall HPI score by clicking the back button here. You can also return to the full map view by clicking the X here. Finally, let's zoom back out to the state level by clicking this icon here. The Healthy Places Index isn't only available at the census tract level. Now, you can easily switch between geographies using the geography switcher indicated here. Note that in addition to common geographies like cities and counties, you can also view the Healthy Places Index at the level of various state and federal legislative districts, as well as OSHPD medical service study areas, elementary school districts, and more. To switch geographies, simply select it from the list. I'll choose cities. As we zoom into the map, you'll begin to see the cities resolve. You can always return to the census tract view in the same way by selecting census tracts from the list. Now let's explore some of the other functions the Healthy Places Index has to offer. You can use the rank function here to quickly identify the highest and lowest ranked tracts in your area of interest. Simply type in the geography you're interested in. I'll use Modesto, for example. The map will zoom to the location and automatically pull up a list of every census tract in the city. By default, it sorts the census tracts from lowest to highest score. You can change that by pressing this icon next to percentile here. It will now list and highlight the top-ranked census tracts. You can see which tract number corresponds with each tract by hovering over it in the list. A thin orange outline indicates the tract selected. This rank function is a useful tool for finding high and low ranked problem areas in a community and might help answer questions such as where should we direct resources, where is most at risk, and what can we learn about the place with the highest rank, and how can that be applied to places ranked much lower? Let's clear this ranking for now so I can demonstrate the next function, pooling. If your project area or jurisdiction is not represented in our selection of geographies, here, you can use the pool function to create your own custom aggregations, or pools, of geographies to suit your needs. To do this, select the pool function, then simply click on the census tracts that you want to add to your pool, like so. If you want to add a large group of tracts at once, click this icon here and use it to draw a box around the tracts you want to select. Click the icon again to go back to selecting single tracts. You can also remove tracts from your pool by clicking them again, like this, or by selecting the X next to the track number in the list here. Once you're satisfied with your selection, click the Pool Census Tracts button. Notice that your pooled tracts now have a single color and a crosshatched background. A new HPI score has been calculated for this group of tracts. You can click on the pool itself to get more information. Here, you'll see the new HPI score for the pool, and you can drill down into each policy action area and indicator in the same way as viewing a single tract, with all the policy action area and indicator scores calculated for your custom pool. We think this function could be especially useful for grant applications, where you might need to generate an overall HPI score for a project area, or to get an estimate of an individual indicator in your custom geography, such as the employed population or access to automobiles. Your custom pool can also be used with the rank function to quickly identify how it compares to other nearby tracts. To clear your pooled tracts, simply return to the pool function here, click on this arrow, and select the Remove Pool button. Let's take a look at another city. I'll pull up Richmond. Now, let's say you've been looking around and you found some useful information here, such as information about this particular census tract, and you'd like to take that in a nicely formatted, ready-to-share package. With our customizable report tool, accessible here, you can easily communicate your findings. To begin, you can customize the report by adding your own introductory text here. We've provided some contextual information by default, but you're welcome to add, modify, or remove it as needed. You can also co-brand the report with your name or the name of an organization. If there are specific indicators that you'd like to include in your report, you can select them here. For each indicator selected, the report will include the definition, the value for the selected geography, data source and year, and general policy actions that can be used to improve it. At the very bottom, you can provide some additional or wrap-up text here. When you're ready, click Download Report. Opening the report, you'll see a mini HPI dashboard with the overall HPI score, visualizations for each policy action area, as well as a map snapshot of your area of interest. On the second page, you'll receive a larger map snapshot. The remaining pages contain your introductory and closing text, as well as detailed information on any indicator you selected to include. Returning to the map, you can also quickly export the data in CSV format for your use via the Data tab. Data that you download here will be for the entire state, and you have the choice to select all indicators or only indicators of interest. If you'd like to go even deeper into the data we have available, you can use the View Indicators feature to switch between viewing the Healthy Places Index, individual HPI indicators, and an array of useful decision support layers. On this tab, you can view individual HPI indicators organized by their policy action area. On this tab, you can access our decision support layers. Among the data available, we've included health outcome and risk behavior data for the most populous cities in California, comprehensive climate change and climate change-related indicators, including climate and sea level rise projections, populations at increased risk from climate change, and adaptive capacity measures, such as impervious surface cover and households with air conditioning. We've also provided decennial census data on a variety of race ethnicities, available here. If you're unsure what a specific layer contains, you can get more information by clicking the arrow here. You can then return to the layer list by clicking the back button here. If you'd like to load a layer onto the map, simply click View on Map next to the indicator you're interested in. Note that the legend now changes, indicating that transit access is now displayed. You can then click on a census tract to get a full complement of information, similar to the HPI indicator detail view. You can remove the layer by clicking Remove from Map. Whenever you remove a layer, the Healthy Places Index is displayed again. This ability to view supplementary data layers is useful for finding health outcome problem areas or areas at an increased risk from climate change and learn more about the community conditions on the ground. As we hear from users about what layers are useful for their work, we plan to continue building out this list, adding layers to respond to interest. You can also use the pool and rank functions with individual HPI indicators or decision support layers, as well as the function I'll demonstrate next, Custom Score. Sometimes you may need more information than what the Healthy Places Index, individual indicators, or decision support layers can provide alone. We designed the Custom Score function, available here, to address that. Here, you can combine individual HPI indicators plus decision support layers to create a custom score that specifically reflects your needs and priorities. You may want to create a custom score to quickly target areas with overlapping risk factors, or perhaps expand our HPI to include indicators that are important to your specific area of work. Before we build a custom score, it is important to note that any score generated here is not weighted, unlike the Healthy Places Index. In the HPI, each policy action area is weighted to maximize its association with life expectancy at birth, the factor that makes the Healthy Places Index so unique and predictive of community health. To create a custom score, simply select a complement of indicators. You can select HPI indicators, decision support layers, or a combination of both. You'll see, as I add indicators, that the legend changes to identify what is included in the custom score. If you want to remove an indicator, click the X next to its name in the legend. Or uncheck the box in the left-hand panel. When you're happy with your custom score, you can explore the map or use the other features like pool, rank, and reporting on your custom score. Let's go ahead and clear our custom score for now and zoom back out to the state. The last function I'll show you is our data upload feature, available here. In the event that we don't have all the layers you need, we've built in a data upload function that allows you to upload your own data and use it in conjunction with our available layers, including the Healthy Places Index. To do so, select Upload Your Own Data and follow the prompts on the screen. The tool accepts CSV files as well as shapefiles and point data, which means you can upload files that include the location of hospitals, for example, or other services key to your work. The uploaded data is for reference only and will be displayed as an overlay on the map. Normally, any data you upload here is visible only to you and will be removed once you navigate away from the map or close your browser. For a small fee, we also offer a user account function, accessible here. A user account gives you the ability to save uploaded layers and access them at any time, even after you leave the map or close your browser window. This is a great resource if you have a lot of data you want to view on our map, or if you have a project you expect will take longer than one session to complete. And with that, you've seen all of the major features of the California Healthy Places Index map. Throughout this video, you learned how to navigate the map and switch geographies, access the HPI, policy action area, and individual indicator percentile rankings, view our comprehensive policy guides, use the rank function to compare census tracts in your community, use the pool function to create your own custom aggregations of census tracts, create an HPI report packed with map snapshots, score summaries, and actionable information, view individual HPI indicators and our decision support layers, create a custom score, and upload your own data. To wrap up, let's take a quick tour of the Healthy Places Index website, where you can get more information on the HPI, including updates, resources, tutorials, and more. To access the HPI website, go directly to healthyplacesindex.org. Our homepage features quick links to the HPI map under Explore Your Community, and more information about who's using the HPI here. We'd also love to hear how you're using the HPI so we can develop new tools and resources to support your work. Up to the menu bar, you can quickly jump to the HPI map through this link, and you can access simple, bite-sized video tutorials for the map on our Get Started page. Here you can see that we have videos for every function the map has to offer, so if you missed a detail in the demo, you can check out the tutorials here as a refresher. You can also access all of our complete policy guides through this Policy Actions link here. These are the same guides linked to from the map, but you can easily access all of them through this index. We've organized them by policy action area. Clicking through to a guide, you'll see that we provide important contextual information in addition to the policy actions accessible by scrolling down. We've also compiled communication tools, resources, and recommendations on how the HPI can be used under the Use HPI in Your Work link. You can access the audience briefs here, as well as learn how the HPI is already being used, and how the Public Health Alliance can help you use the HPI under Export Services. If you'd like general information about the HPI, including what indicators are used, related projects, and more, you're likely to find that on our About page. And if you have specific questions, there's a good chance we've already answered it on our FAQ page. Lastly, if you're technically minded or are interested in the methodology behind the Healthy Places Index, you can access that on our Data and Reports page. Our technical report is available up front, and data downloads, including the HPI master file, individual indicators, decision support layers, and the HPI map shapefile are freely available for you to use. Our website will always have the latest news, updates, and resources for the HPI, so please check back often. Thank you for watching. This concludes the website tour and feature demo of the California Healthy Places Index. We encourage you to try it out for yourself at map.healthyplacesindex.org and visit us on the web at healthyplacesindex.org.
I know that video contained a lot of information to digest, but I hope you found that to be a thorough introduction to our interactive mapping application and website. We can't wait for you to try it out, and we'd love to hear your feedback. Now, I'd like to turn it over to Bill, who will talk about how HPI is already being used.
Thanks, Helen. Well, we have documented many instances of state government agencies, local health departments, community groups, and others who have incorporated HPI into their work since we started developing the tool. I'm sharing a few here to give you a sense of the wide range of potential uses you might want to consider. First, there are a number of uses at the state level in California. HPI has been particularly useful in grant programs that prioritize resources to disadvantaged communities or require an identification of health benefits and concerns in the grant application. Caltrans, the state's transportation agency, has included HPI in its new Sustainable Transportation Planning Grant program as a way to identify disadvantaged communities, which are prioritized for half of the funds each year. The Strategic Growth Council recommends HPI as a tool to identify the health benefits of projects on the grant application for its Transformative Climate Communities program. The California Transportation Commission has included HPI in the latest Active Transportation Program grant application as a way to identify public health concerns in local communities that could benefit from new walking and biking projects. Many of you on the webinar may have seen that the call for proposals for ATP is currently out and applications are due July 31st. In addition, HPI has been included in several recent updates to plans and guidelines, including the new General Plan Guidelines as a tool to use in developing a Healthy Communities chapter or Environmental Justice chapter, the latter of which is now required by Senate Bill 1000. Climate guidance issued by the state, including the new Climate Resiliency Guidebook, and the recent update to the Regional Transportation Plan Guidelines included a public health appendix identifying ways for metropolitan planning organizations to integrate public health into their regional transportation plans, which are updated every 4 years. The State Health Department is also using HPI in a study of Black infant health outcomes. And the California State Parks Department has included HPI as a layer in its recent update to its Community Fact Finder tool. At the local and regional level, HPI has been used to create community profiles in Los Angeles County, to provide data for community health needs assessments in Santa Barbara and Sutter counties, to prioritize investments for several projects by the Riverside Health Department. It is recommended for use by the Heal You Community-Based Coalition in LA County for targeting community investments in communities of high need. It has been added as a data layer to the Southern California Association of Governments' new Active Transportation Database, and as a tool for local health department accreditation. We have a running list of use cases available on the HPI website. If you know of any others or have your own ideas to share, please let us know by filling out the survey on our website. And we want to help you create uses of your own. There are many ways to use HPI for free on our website. And for a small fee, you can set up a premium HPI user account so you can securely upload and save your own data layers to our HPI map and access them at any time, even after you leave the map or close the browser window. We offer flexible pricing tiers depending on your sector and multiple payment options. For the next month, we are offering a special discounted introductory rate to celebrate the launch of HPI. And if you want to go more in depth, the Alliance can offer customized trainings, technical assistance, or other types of services that can help you get the most out of the tool. This includes conducting webinars and how-to trainings for your organization, incorporating HPI into plans or assessments you may be undertaking, including general plans, other types of plans, community health assessments and community health needs assessments, equity assessments, health impact assessments, and so on. We can also generate reports using HPI data, including community profiles. We can also help you host capacity building trainings, helping to make the case for public health and equity among community residents, elected officials, and other decision makers. Help you use HPI to inform policy decisions, including incorporating public health, the social determinants of health, or other health equity framing into policies. And assist with grant application technical assistance, including programs like ATP and the Sustainable Communities Transportation Planning Grants we mentioned on our previous slide. Our website has a list of our potential services, and we would love to hear from you on how we can be of the most help. You can contact us at phasocal@phi.org to learn more and schedule a time to talk with us about your needs. Tracy, I'll turn it back over to you.
Great, thanks, Bill. While it's truly exciting to release the HPI to everyone today, this project is far from static. The very nature of the HPI benefits from each evolution, addition, and improvement over time. At the Alliance, we've been deeply moved and inspired by the many partners, advisors, developers, and allies who have offered constructive feedback, thoughtful guidance, clever ideas, and fresh eyes to the HPI. A few partners do need to be recognized by name. Our steering committee. Many of them have been with us for over 4 years. local health departments across the state, and our regional data committees. The California Department of Public Health that had representatives that have partnered with us from the beginning. Community organizations that provided on the ground real guidance and feedback. Our esteemed colleagues at VCU, Access Maps, who provided our map platform and many iterations, and our valued funders, the California Endowment and Kaiser Permanente. Special thanks to many individuals that have provided essential feedback to help us improve the HPI. We hope we can count on your continued insights as we move forward. And thank you to all of you on the launch webinar. We're so grateful that you took the time to learn about the Healthy Places Index today. Thank you for attending this special event. We hope you saw that HPI goes beyond problem identification alone and really strives to support solution discovery with actionable and concrete policy options. We believe HPI will be a valuable resource to many sectors and see it serving as an entry point for cross-sectoral work. And we hope that with HPI in your hands and hearts, every Californian will have the opportunity to live a healthy life. For those of you working outside of California, if you have interest in learning how to replicate the Healthy Places Index in your community, please contact us. That concludes our presentation. If you wish to stay on for the live Q&A, please sit tight. Thank you again for your time and your interest in the Healthy Places Index. We'll be sending you follow-up information shortly and look forward to hearing about how you put HPI into use for your community. Thank you.